Happy Colorectal Cancer Awareness Month and National Nutrition Month from the Health Promotion Disease Prevention team. Today we'll be discussing more on healthy eating for ultimate disease prevention. We know that good nutrition is essential for keeping Americans healthy across the lifespan. A healthy diet helps children grow and develop and can reduce their risk of chronic diseases, including obesity. We know that adults who eat healthy live a longer life and have a lower risk of obesity, heart disease, type 2 diabetes, and even certain types of cancer. Healthy eating can help people with chronic diseases manage those conditions, as well as prevent further complications. However, most Americans do not have a healthy diet. For one example here, in terms of breastfeeding, we know breastfeeding is the ideal source of nutrition for infants. However, only 1 in 4 moms exclusively breastfeed through 6 months of age, as recommended for the infant. And then in terms of eating enough fruits and vegetables, fewer than 1 in 10 adults and adolescents meet the fruits and vegetable recommendations. And in terms of sodium, 9 in 10 Americans consume more than the recommended amount of sodium. Healthy eating can help prevent being overweight, and as well as obese, and can ultimately lower our risk of chronic conditions. Our healthcare system spends approximately $147 billion each year to pay for those expenses of being obese and the complications that come with that. The Dietary Guidelines for Americans is released every 5 years, and this provides a science-based advice and recommendations to help everyone achieve healthier eating choices, making every bite count. So again, when we eat healthy, this can help with lowering our risk for chronic conditions, as you can see here. The Dietary Guidelines for Americans has 4 guiding principles that can help us make every bite count and make healthier changes in our eating habits. The first is to follow a healthy dietary pattern at every stage of our lifespan. And we also want to take into consideration that it's not a one-size-fits-all eating pattern. You want to customize it so you can enjoy those really nutrient-dense foods and beverages so that it reflects your culture, reflects your traditions, as well as any budgetary considerations. We also want to focus on meeting food groups, getting a variety of the food groups when we're selecting nutrient-dense food and beverage choices. And then the 4th guiding principle is that we want to limit foods higher in added sugar, saturated fat, and sodium, and we'll talk more about that. It's important to acknowledge that our need for nutrients does change over the lifespan. For example, during our body's growth periods, our need for nutrients are the greatest. And these growth periods would occur during infancy, adolescence, as well as pregnancy. And then once our growth periods stop, our needs for certain nutrients would decrease. So keeping in mind that what we eat it can be dependent on just what stage we are in life. Our first tip here towards guiding you towards making healthier food and beverage choices to help with preventing disease is to choose nutrient-dense food and beverages. Nutrient-dense is defined as foods and beverages high in nutrients, but they're relatively low in calories or energy. Nutrient-dense foods contain vitamins, minerals, complex carbohydrates, lean protein, as well as healthy fats. So some examples would include fruits, vegetables, whole grains, low-fat or fat-free dairy products, as well as lean sources of meat, peas, beans, and nuts. And research shows that the American diet is very energy or calorie rich and it's nutrient poor. So when you hear the word empty calories, it's referring to foods that provide a lot of calories or energy without giving us much nutrition. Nutrient dense foods are the opposite. So they're giving us all those important qualities and components that can help with promoting our health. As you can see, we want to focus on 85% of our energy needs coming from our 5 food groups and choose nutrient dense foods from those 5 food groups, where a small fraction, about 15%, should come from foods that are higher in added sugar, saturated fat, as well as sodium. So we want to limit those nutrients. Diets high in saturated fat are associated with increased risk of developing cardiovascular disease, while diets high in sodium can increase our risk of developing high blood pressure. When we're having excess sugars in our diet, this can take away from us meeting those nutrient needs that we want to try to get more of. So nutrients like calcium, fiber, potassium, those are all great nutrients that play an important role in our body that we want to get more of and try to avoid foods with the added sugar. Making these nutrient dense choices and shifts, you can do this one food and beverage choice at a time. It's all an opportunity to work towards a healthier diet pattern. And it's all about those small changes. So this just gives you a few examples of realistic small changes to shift more towards those nutrient dense choices. So looking at these recommendations here, we're focusing on limiting the added sugar by making certain shifts. We're focused on limiting sodium by making certain shifts, and also limiting saturated fat by making shifts. The nutrition facts label can be an awesome tool to help us as consumers make healthier food and beverage choices. The FDA recently released several changes to the nutrition facts label to help it make it easier for consumers to select healthier options. So you can see the serving size is now larger in a bold font, and the serving size is going to include the servings per container. So it's important that just to note the serving size is not a recommendation of how much to eat. It's just the typical serving that a person may eat at one time. And it's also important to note there's likely multiple servings per container. So be mindful of that. The calories are largely displayed in bold font, and this is based on a 2,000 calorie a day guidelines. The percent daily value, you can see that on the far right column, shows how much of a nutrient is in a serving of food. That contributes to your total day's worth. So in terms of percent daily value, 5% or less of a nutrient per serving is considered low, where 20% or higher of a nutrient is considered high. So for those nutrients we're looking to limit, like sodium, saturated fat, added sugar, we want to look for 5% or less of our daily value per serving, whereas nutrients we want to try to get more of, like calcium, iron, and potassium, we want to look for 20% or higher as a great source of those nutrients. Next tip towards making healthier food and beverage choices is to always focus on variety. This is the My Plate tool, which is a nice graphic that gives us a visual of what our plate should look like at each meal. So the main takeaway here is that we want to fill half of our plate with fruits and vegetables. Fruits and vegetables are extremely energy dense, low in calories, high in nutrients. And we want to focus on a rainbow of color, which means we're getting a variety of those nutrients that all have a unique role in promoting our health and preventing disease. You'll notice the second half of our plate we want to fill with grains as well as our protein source. Ideally, with our grains, we want to try to consume whole grains. Whole grains contain the entire grain kernel, so essentially they're less processed. They provide us with more dietary fiber, and that's linked to helping reduce blood cholesterol levels and may even help lowering our risk of heart disease. With our protein foods, Some examples would be seafood, meat, poultry, eggs. There's also plant-based sources of protein like beans, peas, lentils, nuts, and seeds. So to keep our blood cholesterol levels in a healthy range, we want to focus on those lean proteins that are lower in saturated fat. And then, of course, our dairy group would include milk, yogurt, cheese. And we know dairy is really important for providing us with the mineral calcium, which is so important to building and maintaining strong bones throughout the lifespan. Another takeaway is to personalize or customize your plate. And you can do this so that it reflects your own personal preferences, any cultural traditions you might have, as well as keeping in mind any budgetary restrictions. So you can just really take a look at your current eating routine and think of maybe a way or two that you can switch up the choices that you're making to select a more nutrient dense choice than what you're currently eating to help with boosting your health and preventing disease. This graphic here is from IHS, and it's part of the My Native Plate. So it features traditional or indigenous foods in the Native American diet. And we know these traditional foods are extremely nutrient dense and they're in their whole form and they support good health. So here in Wisconsin, some examples of those traditional foods would include berries, corn, beans, squash, wild rice, nuts, fish, bison, venison, and these are all, again, nutrient dense options for us to think about incorporating into our diet. Some tips for incorporating more fruits and vegetables in our diet. You can always stock up on frozen or canned fruits and veggies. You can even plan a main meal around a vegetable, such as a stir fry, stew, or a soup. For our protein, we want to try to choose more non-meat sources of protein, like beans, lentils, eggs, to help kind of cut down on that saturated fat. And then for our grains and starch group, again, we want to focus on the whole grain. So this would come from whole wheat tortillas, oatmeal, wild rice. Those are all examples of whole grains. Our last tip we have for you today is to be mindful of portion control and portion size. Portion size is a term that's used to describe the amount of food or beverage served or consumed in one eating occasion. And a portion size can vary from meal to meal. So, for example, at home, you may serve yourself 2 small pancakes in one portion. But when you go to a restaurant, you may get a large stack of pancakes as one portion. So it's important to pay attention to portion size when we're making food and beverage choices. And the portion sizes that we're now served when we go out to eat, they've increased dramatically in the past few decades. So some ideas or tips, if you do like to go out to eat or you're trying to watch your portions, is you could try ordering 1 or 2 small appetizers instead of a large entree if you're going out to eat. You could even try sharing a larger entree with a friend or family member and asking for a to-go container to take the rest in. And here's a graphic that just gives us an idea of what a recommendation in terms of what a portion size can look like that would be within a healthy recommendation. So can kind of help us from preventing us from overeating. So for example, if you're having rice or pasta using your fist, so about a fist size worth of cooked pasta would be in a healthy portion range. Same with any type of meat, fish, or poultry. You can use the palm of your hand to see what a healthy portion size looks like. When we're eating cheese, you might want to use your thumb. That gives you an idea of what an ounce of cheese would look like. And lastly, to help you support making healthier eating goals one at a time, there's an app you can download from Google Play. It's also on the App Store. It's called Start Simple with My Plate. And it helps you pick simple daily food goals for yourself. You can see your real-time progress on here. There's a fun, interactive way for you to earn badges along the way. And it's really easy to use and can help you make those positive changes. So I encourage everyone to download this app. Of course, if you have any questions, please don't hesitate to reach out. And have a great day, everyone. Thanks so much for tuning in.